Osteoarthritis, understanding and managing joint degeneration. Osteoarthritis is a degenerative joint disease characterized by the breakdown of cartilage within joints, leading to bone-to-bone contact, pain, and impaired joint mobility. While arthritis typically implies joint inflammation, osteoarthritis is primarily associated with age-related joint degeneration. This condition can vary from mild discomfort to severe pain, often exacerbated by movement. Commonly affecting joints such as the knee, hip, hand, foot, or spine, osteoarthritis may also result in the formation of bone spurs or osteophytes near the affected joints. Etiology and risk factors. Osteoarthritis does not have a singular cause, however, advancing age is a prominent risk factor. Research indicates that not all joints deteriorate with age, suggesting additional contributors. Factors such as sports-related injuries, repetitive occupational movements, and genetic predisposition play roles in the development of osteoarthritis. Obesity, joint bleeding episodes, gout, avascular necrosis, chronic inflammation from prior rheumatic illnesses, metabolic disorders like hemochromatosis, and joint infections are identified risk factors. A theory proposes that individuals may be born with defective cartilage, making them more prone to age-related breakdown. Osteoarthritis is a multifactorial condition with a complex interplay of genetic, environmental, and lifestyle elements contributing to its development. While aging is a significant risk factor, various other factors contribute to the onset and progression of osteoarthritis. Genetic predisposition. Individuals with a family history of osteoarthritis are more likely to develop the condition. Certain genetic factors may influence the structure and integrity of joint cartilage, rendering some individuals more susceptible to degeneration with age. Joint abnormalities and congenital factors. Some people may be born with joint abnormalities, including defective cartilage or subtle structural defects in the way joints fit. As these individuals age, these inherent factors may predispose them to early onset osteoarthritis. Joint injuries and trauma. Sports-related injuries and traumatic incidents, such as joint fractures or dislocations, can accelerate the degeneration of cartilage. Repetitive trauma, common in certain occupations or activities, may contribute to the development of osteoarthritis over time. Occupational factors. Jobs that involve repetitive movements or place excessive stress on specific joints may increase the risk of osteoarthritis. Occupations requiring repetitive kneeling, lifting, or bending can contribute to joint wear and tear. Obesity. Excess body weight is a significant modifiable risk factor for osteoarthritis, particularly in weight-bearing joints like the knees and hips. The additional load on joints contributes to cartilage degeneration and accelerates the progression of the disease. Joint bleeding and inflammatory conditions. Conditions associated with repeated bleeding into the joint, such as hemophilia or bleeding disorders, elevate the risk of osteoarthritis. Chronic inflammation resulting from prior rheumatic illnesses, like rheumatoid arthritis, can also contribute to joint degeneration. Metabolic disorders. Metabolic disorders, including hemochromatosis, which leads to an excess of iron in the joints, can contribute to the development of osteoarthritis. These conditions create an unfavorable environment for joint health, promoting degeneration. Gout and pseudogout. Repeated episodes of gout or pseudogout, characterized by the deposition of uric acid or calcium crystals in the joint, can lead to inflammation and contribute to the breakdown of cartilage, increasing the risk of osteoarthritis. Avascular necrosis. Avascular necrosis, where the blood supply to the bone near the joint is interrupted, resulting in bone death and eventual joint damage, can predispose individuals to osteoarthritis. The hip joint is particularly susceptible to avascular necrosis. Joint infections. Infections affecting the joints can cause damage and inflammation, setting the stage for the development of osteoarthritis. Understanding these diverse etiological factors is crucial for tailoring preventive strategies and targeted interventions. While some risk factors are non-modifiable, such as genetic predisposition and congenital factors, others, like obesity and joint injuries, present opportunities for proactive management to reduce the likelihood and impact of osteoarthritis. Epidemiology. Osteoarthritis is a prevalent medical condition, affecting approximately 15.8 million individuals in the United States. Surprisingly, a considerable number of cases go undiagnosed, with up to half of affected individuals unaware that their symptoms of pain and stiffness are indicative of osteoarthritis. Interestingly, women are slightly more prone to osteoarthritis than men. Osteoarthritis stands as one of the most prevalent musculoskeletal disorders globally, impacting millions of individuals across diverse demographics. A comprehensive understanding of the epidemiology of osteoarthritis sheds light on its prevalence, demographics, and societal implications. Prevalence: osteoarthritis is widespread, affecting a substantial portion of the population. In the United States alone, an estimated 15.8 million individuals grapple with the challenges posed by osteoarthritis. However, it is essential to note that a significant number of cases go undiagnosed, with up to half of those affected unaware that their symptoms are indicative of osteoarthritis. This underlines the silent burden carried by the condition within the community. Demographics: while osteoarthritis does not discriminate based on gender, women are slightly more predisposed to developing the condition than men. The reasons for this gender disparity remain an area of exploration within the field of osteoarthritis research. Understanding such demographic nuances is crucial for tailoring healthcare strategies and interventions. Age as a predominant factor: age is a leading risk factor for osteoarthritis, with the prevalence of the condition increasing as individuals advance in years. The aging population, particularly in developed countries, contributes to the rising burden of osteoarthritis. As life expectancy continues to grow, there is a corresponding increase in the number of individuals susceptible to age-related degenerative joint diseases. Underdiagnosis and lack of awareness: one striking aspect of osteoarthritis epidemiology is the underdiagnosis of the condition. A considerable proportion of individuals experiencing symptoms related to osteoarthritis may not seek medical attention, attributing discomfort to the natural aging process or other non-articular causes. This lack of awareness contributes to the substantial number of undetected cases and underscores the importance of public health initiatives to enhance awareness and early detection. Global impact: osteoarthritis is not confined to specific geographical regions, it is a global health concern. The burden of osteoarthritis extends beyond its impact on individual lives, influencing healthcare systems, economies, and societal well-being. The rising prevalence underscores the need for concerted efforts in research, prevention, and management to address the multifaceted challenges posed by osteoarthritis. Challenges and opportunities: the epidemiology of osteoarthritis presents challenges in terms of underreporting, underdiagnosis, and the increasing burden associated with an aging population. However, it also provides opportunities for proactive intervention, lifestyle modifications, and public health initiatives aimed at reducing risk factors and improving early detection. Symptoms: symptoms of osteoarthritis encompass joint pain, with or without swelling, reduced flexibility after periods of inactivity, the formation of Heberden's nodes or Bouchard's nodes, bony lumps on fingers, a grinding sensation during joint movement, and potential numbness or tingling in limbs due to nerve compression. The pain is often described as a deep ache, intensified by joint use and relieved by rest. Nighttime pain can significantly impact sleep as the disease progresses. Symptoms: joint pain and swelling. Osteoarthritis manifests primarily as joint pain, often exacerbated by movement. The pain is typically localized and can vary in intensity. While joint swelling may occur, it is usually less prominent than in inflammatory arthritis. Limited flexibility. Reduced joint flexibility, especially after periods of inactivity, is a common feature. Individuals with osteoarthritis may experience stiffness upon waking up or after prolonged sitting. Bony lumps, nodes, Heberden's nodes, bony lumps at the end of fingers, and Bouchard's nodes, lumps on the middle joints of fingers, are characteristic findings in hand osteoarthritis. These nodes reflect the formation of osteophytes or bone spurs. Grinding sensation. A notable symptom is a grinding sensation, known as crepitus, during joint movement. This arises from the bones rubbing against each other due to cartilage loss. Numbness or tingling. In advanced cases, osteoarthritis may cause nerve compression, leading to sensations of numbness or tingling in the affected limb. Nighttime pain. As the disease progresses, nighttime pain can become significant, affecting sleep quality and overall well-being. Diagnosis. A comprehensive diagnosis involves evaluating familial osteoarthritis history, physical examination for joint tenderness and swelling, and imaging studies like X-rays. Notably, X-rays may not reveal early-stage osteoarthritis, and some individuals may show joint degeneration on X-rays without experiencing symptoms. Blood tests may be ordered to rule out other arthritic conditions. Clinical evaluation. Physicians evaluate patients for tenderness, warmth, and swelling around the affected joint or joints. A comprehensive medical history, including a family history of osteoarthritis, aids in diagnosis. Imaging studies. X-rays are commonly used to visualize joint changes associated with osteoarthritis. While not always revealing in early stages, X-rays can show joint space narrowing, osteophyte formation, and other characteristic changes. Blood tests. While blood tests are not diagnostic for osteoarthritis, they may be ordered to rule out other arthritic conditions that share symptoms. Preventive measures. While preventing osteoarthritis is challenging, managing risk factors can be beneficial. Maintaining an optimal body weight and minimizing the risk of major accidents and injuries are practical preventive measures. Addressing conditions like hemochromatosis, gout, or infections that may contribute to joint damage is also recommended. Treatment approaches. The primary goals of osteoarthritis treatment are pain management and preserving joint function. Over-the-counter pain relievers like acetaminophen can alleviate pain, while nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen may be prescribed. In some cases, cyclooxygenase 2, COX-2, inhibitors like celecoxib are preferred, especially for individuals at risk of gastrointestinal complications. Corticosteroid injections may be considered for significant inflammation, although their use is limited due to potential joint damage. Hyaluronate injections, providing joint lubrication, are approved for knee osteoarthritis. Glucosamine sulfate supplements and capsaicin-containing creams may offer modest benefits, but evidence supporting their efficacy is not definitive. Heat and cold applications, along with guided exercises, can temporarily relieve pain and improve joint flexibility. Weight management is crucial, and physical therapists can assist in developing exercise programs to alleviate joint stress. In advanced cases, surgical interventions, such as joint deformity correction or hip/knee joint reconstruction or replacement, may be recommended. Pain management. Over-the-counter pain relievers like acetaminophen can help manage pain. Nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, may be recommended, with caution in individuals at risk of gastrointestinal issues. Injections. In cases of significant inflammation, joint fluid removal and corticosteroid injections may be considered. Hyaluronate injections provide lubrication and are approved for knee osteoarthritis. Supplements and topical treatments. Glucosamine sulfate supplements and capsaicin-containing creams may offer modest relief. Heat and cold applications, along with guided exercises, can alleviate pain temporarily. Weight management and exercise. Maintaining an optimal body weight and engaging in prescribed exercises, guided by physical therapists, are essential for managing symptoms and preserving joint function. Surgical interventions. In severe cases with substantial joint deterioration, surgical options, including joint reconstruction or replacement, may be recommended to improve function and quality of life. Prognosis. Osteoarthritis is a chronic, progressive condition that significantly impacts the joints, and its prognosis is influenced by various factors, including the extent of joint damage, individual response to treatment, and lifestyle modifications. Understanding the prognosis is crucial for individuals and healthcare professionals to develop effective management strategies. Long-lasting nature. Osteoarthritis is characterized by its long-lasting nature. Once diagnosed, it typically persists over an individual's lifetime. The progression of the disease, however, varies among individuals. While some may experience a slow and gradual deterioration of joint function, others may see a more rapid decline. Worsening over time. The natural course of osteoarthritis involves a slow worsening of symptoms and joint degeneration over time. As the condition progresses, joint pain, stiffness, and functional limitations tend to become more pronounced. While interventions can alleviate symptoms and slow the progression, a complete reversal of joint damage is generally not achievable. Response to treatment. The prognosis is influenced by how well an individual responds to various treatment modalities. Pain management strategies, including medications, injections, and lifestyle modifications, can significantly improve the quality of life for many individuals with osteoarthritis. However, responses can vary, and some may find relief more challenging to achieve. Lifestyle modifications. Engaging in proactive lifestyle modifications plays a pivotal role in influencing the prognosis of osteoarthritis. Weight management, regular exercise, and joint protection measures can positively impact the progression of the disease and enhance overall joint health. Joint-specific considerations. The prognosis also varies based on the joints affected. Weight-bearing joints, such as the knees and hips, may experience more significant challenges due to the mechanical stresses placed on them. In contrast, osteoarthritis in non-weight-bearing joints may progress more slowly. Preventive measures. While osteoarthritis is a chronic condition, preventive measures can influence its trajectory. Managing modifiable risk factors, such as obesity, joint injuries, and underlying medical conditions, can help slow the progression of joint degeneration. Surgical interventions. In cases where conservative treatments are insufficient, surgical interventions may be considered. Joint replacement surgeries, such as knee or hip replacement, can provide significant relief for individuals with advanced osteoarthritis. The success and longevity of these interventions contribute to the overall prognosis. Quality of life considerations. Ultimately, the prognosis of osteoarthritis extends beyond clinical measures. It encompasses the individual's quality of life, functional abilities, and overall well-being. Effective management, early intervention, and a multidisciplinary approach that considers the physical, emotional, and social aspects of the individual contribute to a more positive prognosis. In conclusion, while osteoarthritis is a chronic condition with a tendency to worsen over time, proactive management, lifestyle modifications, and timely interventions can significantly influence the prognosis, allowing individuals to lead fulfilling lives despite the challenges posed by this degenerative joint disease. Your health matters. Quali.health